In May of 2014, we'd been made aware previously of an incident where it related to a member of the Splatsin First Nation community entering Vernon Jubilee Hospital, and the experience that patient received was less than we would expect to be able to be delivering that care for that individual. What it actually brought to light was that we had quite a significant gap, both in cultural safety knowledge and also our connections with our local First Nation communities. As we said, in May 2014, we were invited to participate in the first Splatsin Roundtable meeting, and a group of individuals from Vernon Jubilee Hospital went to meet with the First Nations community leaders and health staff, really with a view to try and understand how we could foster those relationships and develop some community integration between the community and the hospital. I think for me, really, personally, the concern that I had was understanding that a lot of First Nations people have huge difficulty in understanding the healthcare system and accessing it, and we wanted to make that more accessible. One of the clear outcomes that came from that first meeting was that we needed to provide some education and support around the services that we delivered at the hospital, and also try and integrate that with the Splatsin Health Services team to really make them feel part and parcel of the team at Vernon Jubilee. The first initiative that we looked at was the emergency department walkthroughs, and what that really meant was that we were trying to get both staff and community partners, so both the healthcare staff and some of the elders from the Splatsin First Nation community, to come in and actually experience a walkthrough, understanding what the emergency department is about, how that would actually affect them, and really we were trying to get to a point where they could spread that message back to their own community. We have an Aboriginal patient navigator here at Vernon Jubilee Hospital, and that person again was really integral to assisting us in trying to make this actually come to life. Again, one of the problems that we have is people understanding that we actually have that service. And another initiative that we had at that point in time was to actually really promote the role of the Aboriginal patient navigator, so that when our patients arrive at our registration department, they know that we have the service available, and that should they wish to connect with the Aboriginal patient navigator, that they can. The walkthroughs took place. We had 3 series of walkthroughs involving a lot of frontline staff as well. And again, what we've found is that the relationships that have been developed through this have really brought a huge amount of strength to the department. We've started to try and develop a contagious culture where people are a lot more aware of their roles and responsibilities, and education around cultural safety, dealing with First Nation clients. And very specifically, what it really has done for us is it's allowed us to pull in the Splatsin First Nation Health Centre team into some of our discharge planning rounds, and allowed us to really support clients as they move home. For me, as a health services director at Vernon Jubilee Hospital, this is a key strategy for us to try and engage our communities. And this is, as I say, is one of the very first opportunities that we've had.
Cool.
I can't think of anything else.
Good. You think so? You did I think you did fine.
Yeah.